Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, and I'm back in our Sunflower House for a special Labor Day reprise. Boy, you can smell fall in the air. It's getting cooler in the morning. Just heard the sound of the school bus. It's kind of the mark of a new season, and Labor Day is kind of an end of celebration of the summer and getting ready for a new school year. And labor can actually mean delivering a baby. And we wanted to reprise and highlight some of the things in season 1 and season 2 and give you a little bit of an update. We're looking forward to being back soon on our email platform. If you've subscribed to our free e-newsletter and health tip, you might have noticed you haven't gotten anything in a few months. And that's because we're busy building a new platform to bring you bigger and better women's health engaging information. You could always bookmark our website and check it for updated news. If you like to do social media, you can follow us. And as you might know, we're in the second season of our podcast. And last Labor Day of 2023, we had a podcast on labor, delivery, working people, babies, and women's health information. Most of our information is focused on midlife and beyond women, but we have a plethora of information that can be applicable to all people, especially in the fields of nutrition and health promotion and anti-aging. And we plan to have some more upcoming podcasts on pregnancy, like exercise in pregnancy. I am very blessed that we just welcomed a new baby into our family. My nephew Keaton, who I like to joke is my fourth son. He just had his first baby, a baby boy, or his wife, of course, is the one who went through labor and delivery, Jody. And just last week, a big, healthy 8-pound, 8-ounce boy, Samuel Gray, was delivered. And it was in August, which is Breastfeeding Awareness Month. And so they're embarking on family breastfeeding in terms of you have to have supportive members. And I immediately sent them the link to the breastfeeding podcast that we just recently did. And now that we've had well over 120 podcasts, you can't really search for information or topics on the podcast. And if you've been following us from the beginning and you've subscribed, you get notified. And of course, it's all for free. And you can determine whether you want to listen to the topic. And hopefully you want to listen to most of them because we try to make it as applicable and filled with just lots of information to empower you to be strong, be happy, and be in charge. You can actually go on our speakingofwomenshealth.com website and tap search. And you can search within our website. Now, if you're on your podcast app and you're trying to find us, like say Apple Podcast or Spotify or anywhere you listen to podcasts, you can either type Speaking of Women's Health, or you can hit the microphone and say Speaking of Women's Health, and the purple icon with the microphone should pop right up. And ensure that you select all podcasts for Speaking of Women's Health and tap the follow or subscribe button, which is free. And then you can tap on the library and start listening. You can go slower, you can speed it up. Some of my patients tell me, when I listen to your podcast, you're talking slower than you do when I see you in the office. I have to put it at 1.25 speed. My son Stetson, who's been on the podcast and who's starting his own podcast, and I hope to interview him soon on general health topics and genetics and anti-aging and other kind of exercise and life health hacks. He listens to so many podcasts on 2 times the speed. So it all just depends on what you feel more comfortable with. But you can do this in your podcast app, and you can't do it on the website, even though you can listen to our podcast on the website. Now, we're also on YouTube. You can go to YouTube on your phone or computer or mobile device and type in or say, Speaking of Women's Health, and just click on the subscribe link. And you can see our podcast. You can see other YouTube video interviews we've done on Speaking of Women's Health. Everything is pretty similar if you're on Spotify. If you're on Rumble, we're called Speaking of Women's Health. So smartphones, computers, tablets seem to be a popular way to listen to podcasts. People can also listen on their Alexa or their Apple Watches. I kind of have an old-fashioned watch. So hopefully you've subscribed to follow the podcast. And if you already listened to last year's podcast on labor, you might want to listen to it again because there are so many health tips, and so much of what happens during pregnancy and the health of a pregnant woman does translate into her midlife and beyond health. We just want to make sure that we stay connected with you. We have channels on Instagram and Facebook and X, formerly Twitter, and Threads and Pinterest and LinkedIn and Telegram. We like to feature columns and health articles and free treatment guidebooks, healthy recipes, health calculators. We have information about our concierge custom fit physical program for women, which is a comprehensive set of an evaluation that's coordinated with our wonderful lead nurse, Alex, and you can learn about the program on our website. And if you're able to, we'd like you to consider supporting Speaking of Women's Health, our nonprofit. 100% of the donations go straight to running Speaking of Women's Health, and we're continuously working to provide you with engaging and fresh, helpful content, and we're so grateful for your ongoing support. Thanks for being a loyal follower. Thanks for listening to our podcast, and please give us a 5-star rating, and you can share our content. It's all free with any of your friends and family. And we want to celebrate all moms, new moms, older moms, grandmothers for helping family members, fathers. My nephew Keaton took a few weeks off from his new business to be right there to support the mom and the baby, and his stepdaughter Sadie, my brother, a man's man, an engineer, is calling and texting me, about the new baby. So it really behooves all of us to support healthy families at all stages. And now on to our podcast on labor, and happy Labor Day. Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker. On this Labor Day 2023, and today's podcast is, what are you doing on Labor Day? And why don't we talk about labor and pregnancy? So Labor Day is the American holiday to celebrate our workforce and all the hard workers who make our country great. My granddaughter Artemis always likes to say, I'm an American, Mimi. And she's so proud every time she sees an American flag. So this American holiday tends to be a family weekend, celebrating the end of summer, as sad as that might be, and the beginning of back to school. And we do have some good back to school information. And even though we focus a lot on midlife women's health and menopause and perimenopause, areas of my expertise, we do have information about younger women's health issues and how those translate to issues later in life. So, Labor Day also can be the kickoff for political campaigns, and certainly for our military families who may be separated from loved ones while serving our nation. It can be a very keen and solemn reminder of the great sacrifices of those who serve. And so we certainly honor our military men and military women who keep America strong, because America has been a beacon of freedom and hope worldwide. Now, the word labor to most women's health physicians and nurses usually means something long and physically arduous, the process of bringing new life into the world. And as workers, physicians and nurses and allied health work 24/7 to care for our patients. So please, if you're interested in younger women's health issues, pregnancy issues, breastfeeding, and really any healthcare issue for your family, stay tuned to our Twitter post, our Facebook post, Instagram. Check out speakingofwomenshealth.com. And if you don't already get our free e-newsletter, click on the subscribe button. And we do have lots of tips for younger women and pregnant women. As far as a large and diverse workforce on Labor Day, the Cleveland Clinic is the largest employer in Ohio. And I am saluting all of our terrific Cleveland Clinic workers and caregivers who are here, not just in Cleveland, but in several locations worldwide. So I'd like to move into pregnancy. And certainly I have been excited to witness the pregnancies of my daughter-in-laws. I now have 3 grandchildren, as you probably know if you've been listening to our Speaking of Women's Health podcast. And there's just few life events that compare to the 280 plus day or so journey called pregnancy, which culminates in labor. The roller coaster ride of excitement and anxiety combined with the waiting and all the massive physical changes can be overwhelming, especially the first time. But a positive experience with pregnancy is within your reach. Now, don't tune out if you're past the age of childbearing or you're not planning to childbear. Inevitably, if you've already had children, what happened during your pregnancy and delivery and afterwards actually translates to midlife and beyond. So we're going to talk about that. In addition, most people know someone who might be expecting. I was just at my Shoreby Club yesterday and struck up a conversation with a nice young lady who was expecting her first baby. And she told me how she hired a doula and what she was planning to do and how excited she was. And so inevitably, you're going to interact with people that are expecting babies. And it's in all of our interest to support healthy pregnancy and delivery and the bringing of children, future workers, to celebrate Labor Day into our world. So I am not an obstetrician, but I certainly have lots of obstetricians that have worked in our Center for Specialized Women's Health and have contributed great articles on this, as well as women who are women's health specialists who have undergone pregnancy and delivery and lactation. So lots of great information that you can access on Speaking of Women's Health. So for the pregnant woman, it's important to understand the myriad of changes that are going on. Certainly the first thing that happens is the fertilized egg attaches to the wall and begins the process of life and the development of the placenta, which serves as a bridge between the baby and the mother, filtering and exchanging nutrients, oxygen, gases, carrying immune cells to the developing baby. It also produces and secretes important hormones, like a lot of extra estrogen, which is critical for you and your developing baby. And it stimulates other hormones that affect the growth of the uterus, the big muscle that houses the baby. It helps enlarge the milk ducts, opens up blood vessels to ensure that blood can go easily between you and your baby. One of the reasons why a mother's health is so important during pregnancy is that it influences the way the placenta functions. And the health of the placenta has a major influence on the baby's health, both inside the womb and long after the birth. In fact, my middle son, Emerson, who just became a father on right before Thanksgiving, named his son Lincoln in honor of President Lincoln, who officially made the proclamation for Thanksgiving to be an official American holiday. My son, he's a banker, he's not medical, although he took biology, and he actually did a science internship doing research in the lab. He was most impressed after the delivery that the obstetrician held up the placenta and was admiring how healthy the placenta was, because that is very important for the health of the baby. And if the placenta has disease, if you've had a placental abruption, if the placenta is not very healthy, that implies that there has been some potential compromise. And that's why, even if you've long forgotten labor pains, even if you've passed that phase, maybe you're already past reproductive age, you're menopausal, understanding and bringing to your physician your obstetrical history is very important, from infertility to whether you had gestational diabetes, which can increase the risk of future obstructive sleep apnea by 90%, as well as developing insulin resistance. And we've had a lot of podcasts on how to be less sweet and how to reduce insulin resistance. If you've had pregnancy-induced hypertension, PIH, or preeclampsia, or outright eclampsia, which is toxemia of pregnancy with seizures, that can portend more cardiovascular disease. So a healthy pregnancy and the effects of pregnancy have some long-reaching effects. So when you're pregnant, you're eating for two, sometimes more if you have multiples. I think about 1 in 80 to 90 pregnancies result in twins. And last month in Cleveland, they had the Twins Festival in Twinsburg, which is like the largest gathering in the world, I think, of twins. And it's like you're seeing doubles and triples and quadruples, because sometimes triplets and quintuplets show up. And there's a lot of research done on that. So interesting. But most of the time, a woman is eating for two. And you need enough energy to sustain you and your baby. But that's not really the same as eating for two people, because your well-meaning friends and family might be pushing you to eat more than you need. Because when you look at what your caloric needs are, it's surprisingly not as much as you would think. During the first trimester, it's about 100 calories, which is like an additional small glass of low-fat milk per day. You might want to increase your calories to about 250 calories per day during the second trimester, which is just a piece of fruit or a little handful of nuts. And in the last trimester, 300 calories, which could be 2 pieces of fruit or just a really big apple. In fact, during my pregnancy, all I remember eating was actually less food for the first several weeks due to nausea. We've got some good information about preventing nausea in pregnancy. And so for 6 months, maybe I ate an extra apple a day. And that made a 8-pound, 4-ounce baby Stetson and caused about 27 pounds of total weight gain. Granted, a lot of that is fluid, and some of it's the placenta, and some of it's extra body fat to support lactation. When my patients complain that they can't lose weight and that they're eating normally, I remind them that to gain 30 pounds in the span of 9 months, you're just basically for 6 months eating a big apple for 6 months. And so a lot of times it's not how much you're eating, or it's not the calories or the food you're eating, but it can be the timing and how much you're burning. Now, the quality of your food choices really are so much more important than the quantity. So if you haven't already adopted a healthy lifestyle, and if you're not pregnant but you're supporting someone who's pregnant in your family, it really will serve you well to get really good eating habits now and for your baby in the future. So things like fruits and vegetables, lean proteins, low fat dairy. We did a great podcast on cheese. And there are some cheeses that pregnant women should avoid, like the soft cheeses that can be associated with listeria. You do want to always, at any time in life, avoid trans fats or too much fats, simple sugars, avoid the seed oils and the high fructose corn syrup, and any bleached flour products, anything that's highly processed. Now, your obstetrician or family physician may recommend a daily prenatal vitamin. Certainly before pregnancy, it's so important to get enough folic acid. Regular folic acid has a short half-life of a vitamin 6 hours. In fact, I was pregnant with my second son, Emerson, breastfeeding my first baby, Stetson, at 9 months. I think I was the thinnest I ever was in my life, pretty nutritionally depleted. And that was right before the research came out that if you have enough folic acid before pregnancy, you have a much lower risk of neural tube defects and spina bifida. And when that research hit, I think I was about 3 months pregnant with Emerson, and I'm like, oh gosh, I hope I got enough folic acid, because I had so much nausea and vomiting that I really didn't feel like eating. So sometimes the prenatal vitamins can make you nauseated. So if that's the case, I think that you might want to just take folic acid. And if before pregnancy you take optimized folate, also known as L-methylfolate or levomefolate, that is the L isomer, and it's a much longer half-life of folic acid, like 120 days, the length of time that your red blood cells live. So I think ideally anyone who could potentially become pregnant should have optimized folate, because then if they have a period of even just a couple days or a few weeks when the brain is critically forming, sometimes even before you know you're pregnant, that can cause some issues. Now, other things that prenatal vitamins have, the most important, as I mentioned early on, is folic acid, but also the omega-3s like DHA, docosahexaenoid acid. And I have done, or it will be posting, a podcast on the omega-3s and why they're so important. Now, they are found in fish, but when you're pregnant, you have to choose the low mercury content options and probably not have fish more than once or twice a week. Now, there's lots of other omega-3s in chia seeds and flax seeds and walnuts, many eggs. If they feed the chickens omega-3 foods, I think that's a good source. And eggs also have choline, which are good for the brain and eyes and muscle. In fact, my daughter-in-law, Laura, who's the mother of Artemis and Beatrice, she tells me Artemis is so smart because she ate so many eggs and had so much choline and brain and heart healthy fats in her diet when she was pregnant. So if you are taking an omega-3 in your prenatal, I usually recommend about 300 to 600 milligrams per day. But even with the best intentions, sometimes when your cravings for certain foods may win out, don't be too hard on yourself, but do make an effort to eat as healthy as you can during your pregnancy. And of course, please avoid toxins. Avoid alcohol during pregnancy. Avoid tobacco. But there are other toxins like nitrates and methylates, which are found in hot dogs and processed lunch meats, and saturated fats that can affect the DNA. Also, excessive radiation from excessive exposure to X-rays can impact a developing fetus. So if you're a healthcare worker on Labor Day and you're working around X-rays, obviously complete shielding is very important. There's also other toxic compounds like bisphenol A, BPA containing compounds that are found in plastic bottles and inside of some cans that can affect the brain and the reproductive system. So when you're using plastic bottles and drinking from them, look for the number 2 or 4, but not 3, 6, 7, 8, or 9 in that triangle on the bottom of the bottle. A1 is acceptable but not reusable. Finally, there are hundreds of thousands of babies that are born in the United States every year with unsafe levels of mercury, which is associated with developmental delays. I usually tell pregnant women to limit their use of tuna because of mercury to less than 6 ounces per week. Also important during pregnancy is don't stop moving. Although it's not a good time to start some entirely new workout that you're not used to or change the intensity of your regimen. And certain activities like scuba diving, intense activities with very high heat, contact sports, this is not the time to start these new activities. But know that the female body is designed to withstand some physical stress. And what I told the young woman that I met yesterday at the pool who was pregnant and sporting, a cute little abdomen at her 6-month mark, that even though labor can be painful and can be long and arduous, when you go through that, you really are empowered. And I think going through that does make you a stronger person. Now, walking for 30 minutes a day does give some baseline level of fitness. Do not get overheated. Do some flexibility training, which is an excellent way to prepare for delivery. Try to reduce stress. Being the center of attention of all your family and friends and coworkers and neighbors can be fun, but can be overwhelming. Everybody seems to be an expert when it comes to pregnancy, delivery, and newborn care. Really getting good knowledge is your best defense, and keep a list of questions to discuss with your obstetrician or midwife, and don't be afraid to ask questions. He or she can provide you with some answers or some good resources to relay on to family and friends. And I also like to tell women to trust themselves and to prepare in advance. If you don't have a medical background, just understanding the 3 stages of labor. This young woman I met yesterday told me that she was hiring a doula, which is a woman who has had a natural vaginal delivery on her own, not necessarily medical, but is there to support the woman. I initially had wanted, based on the research, to hire a doula myself, but my husband was like, no, this is just displacing me. And so I didn't do it, but I kind of really wish I would have, because I had a very long delivery with my first son, who the nurses called Bruiser because he had facial palsy, and he came out with an Apgar of 1 and meconium and all this drama. And I did hire a doula with the 2nd and 3rd, and I was telling her yesterday that the 3rd delivery was within 15 minutes of getting to the hospital, because after your body's done this, it's usually a little bit easier and sometimes quicker. But she was so helpful to me because I was in false labor with Grayson for so many days, and I had stopped eating much food because with my other 2 labors and deliveries, I threw up, and I just didn't want food in my stomach to throw up. And when she found out that I hadn't eaten anything, she's like, no wonder you keep going into false labor. Eat something hearty. So my husband made me lentil soup, which was very healthy and hearty. And boom, I had Grayson not that long afterwards. So sometimes having someone wise who has been through things, even if they're not medical, can be a support. On the other hand, it is important to get good medical information as well, and to be prepared. There's lots of forms of pain relief. I find that women are most afraid of the baby's head coming out the perineum, but really the most painful part of labor is the contractions. But you always usually get a break in between the uterine contractions. And once the baby's head is engaged, the nerves are really numb. And so I tell women not to be fearful of that part. And if you're healthy and you are in good shape and you have good support, trying to labor comfortably when you're in a comfortable environment at home, many times women find that they feel a lot more comfortable. Other women really want to be immediately in a medical care setting. So everyone is different, and it's important to have shared decision making with your medical team. Now I'm going to go on to go over some of the information that one of our fellow graduates, who has now been in practice for several years in Chicago, Dr. Christy Tuft DeSapri. She has a great column on our website, Navigating Pregnancy with an MD Mom, First Trimester. And Dr. Tuft is an osteoporosis expert. In fact, I interviewed her for one of the CME podcasts on osteoporosis. And if you're interested in osteoporosis, I would go back and listen to that. That is just fabulous. Anyway, she has 3 sons like I do. And she has had great experience with pregnancy and delivery and being a working mom. So her column that she posted initially in 2014 and she updated in 2020 was that statistics show that 1 in 2 pregnancies are unplanned or mistimed. So chances are if you're pregnant, you belong to the surprised group or the planned pregnancy group. And there's some great pictures of her and her sons on our website. So Dr. Tuft said she was a member of both cohorts, planned and unplanned. And so she wanted to just share her personal experience and medical advice aimed to educate and empower both new and seasoned moms to be. And the wisdom derives from her dedication as a physician specializing in women's health and being the mom of happy, active, hungry sons. So nausea and fatigue in the first trimester, it brings a lot of mixed emotions, excitement, nervousness for the next 10 lunar months ahead. The long haul of a full-term pregnancy is 40 weeks, and for some, including myself and one of my daughter-in-laws, sometimes 41 plus weeks, up to 42 weeks. And early on, it can be combined with fatigue and nausea. At least 75% of women experience some nausea or vomiting from pregnancy. That can last all day, so I'm not sure why it's called morning sickness. I used to get nauseated if I stood up at night to walk to the bathroom. I would try to stay low to the ground to not lift my head up. Nausea tends to be worse at weeks 8 to 9 when the hormone levels of HCG are the highest. Most women get symptom relief by 14, 15 weeks, but 1% of unlucky women who've had serious medical conditions called hyperemesis gravidarum can become dehydrated or lose weight due to excessive vomiting and food aversions. And I've certainly had more than one of my patients tell me about this in their obstetrical history and how they had to be hospitalized for IV hydration. Now, there's a lot of tips for alleviating nausea and morning sickness. Certainly, good lifestyle helps. Eating small amounts, frequently, high in proteins and complex carbohydrates, like, say, nut butter with whole grain bread, a little cheese, dry fruits. I lived on sucking on watermelons because I couldn't even drink water, and that's how I stayed hydrated. Caffeine can increase stomach acids and make symptoms worse, but in general, pregnant women can have about 200 milligrams maximum of caffeine per day, which translates out to about a 12-ounce cup of regular coffee. Get enough sleep. If you don't have enough sleep, your nausea will be worse. In terms of vitamins, if the above tips don't help, try increasing your B6 pyridoxine intake to 25 milligrams twice daily. That was a lifesaver for me. It allowed me to continue to work. Personally, I'm talking about myself. Medications. Sometimes they will prescribe Zofran, which is ondansetron, but that's usually for nausea associated with chemotherapy. Sometimes they have to use stronger medications if the person has hyperemesis gravidarum. But there is now a relatively newer medicine called diclesgis, which is a combination of B6 pyridoxine, which you can buy over the counter, and doxylamine, And that's combined, and that is FDA approved to help with severe pregnancy nausea. Certainly, before taking any medications when you're pregnant or breastfeeding, check with your healthcare clinician. But don't suffer in silence. And remember, this podcast is not medical advice. This is just to empower you to be strong, be healthy, and be in charge. And you're actually listening to the Speaking of Women's Health podcast with your host, Dr. Holly Thacker, who is not an obstetrician. I like to tell people I delivered my 23rd baby on my 23rd birthday on January 23rd, and that was enough. That was my sign I had done enough obstetrics. So, getting back to being a pregnant woman, your first trimester appointment. Dr. Tuff, said that despite being a physician and going through medical school, and she actually did obstetrics and gynecology for a year before she did internal medicine, and then her 2-year specialty fellowship at the Cleveland Clinic, and then went on to have her 3 children. She said she felt a bit overwhelmed about all the information and counseling. The screening test, there's lots of different screening tests, and we have information on DNA testing and ultrasound information on the website. There can be chorionic villus sampling or amniocentesis. Most all women get ultrasounds in the first trimester, looking for a heartbeat, looking at the neck thickness. There is an FDA-approved single blood test that can be done to detect fetal cells and can be done as soon as 10 weeks. Usually it's done for higher risk women with family histories, advanced age, or anything that's concerning. So each trimester is unique, and it's kind of like the first day of school, which is coming up since it's Labor Day. Growing in utero takes a few weeks, and I think to just worry about the delivery and the labor pain early on, you have plenty of time for that later, Dr. Tuff says. So some of the do's and don'ts in the first trimester. Prenatal vitamins. Make sure at least you have the folic acid. Don't smoke. Abstain from alcohol, and review all medicines and supplements with your physician. Know about the miscarriage signs, because women do have miscarriages, also known as spontaneous abortions. If you have heavy bleeding or cramps, contact your doctor or midwife. Get some weekly updates. Dr. Christy Tuff DeSapri used pregnancy and childbirth month to month. Her husband, a financial guru, actually enjoyed reading these weekly updates. And realize that in the first trimester, you're kind of in survival mode. And be patient with yourself and understand that these novel hormonal changes are growing a beautiful baby inside of you. So more about Dr. Tuff DeSapri. She's a board-certified internist, and after fellowship training, she worked in private practice and academic medicine for over 13 years, director of the Western Women's Bone Program at the Center for Sexual Medicine and Menopause at Northwestern Menopause Medicine in Chicago. And she now runs Bone and Body Women's Health, which is a concierge midlife women's health practice in Winnetka, Illinois. And she focuses on the consultation and management of perimenopause, menopause, osteoporosis, and sexual health. You could follow her on Instagram at Bone and Body WH. And she does, even though she's not doing obstetrics, I know that she gets obstetrical histories just like I do, and many astute women's health physicians, because the histories of a baby over 9 pounds, gestational diabetes, postpartum depression, pregnancy-induced hypertension, the HELLP, HELLP syndrome, all of those can portend higher risk for other medical conditions in midlife. So thanks so much for joining me back in the Sunflower House on this Labor Day. I hope you are having or have had a wonderful time with your family and taken the day to rest and reflect on the summer and the new academic year. If you don't already follow us on our free podcast, please be sure to click either the subscribe or the follow button on Apple Podcast, Google Podcast, Spotify, Overcast, Amazon Music, Castbox, Podcast Addict, iHeartRadio. And I hope that you'll join us again in the Sunflower House. And remember, be strong, be healthy, and be in charge. And I will join you next time